और तुम्हारा यूट्यूब का वो तो उसको स्पीकर दो।
on an annual basis. Thus, the present one is third in series. This year, we have the privilege of having our oration being delivered by Professor B. N. Gangadhar, Director, National Institute of Mental Health and Neurosciences, better known as NIMHANS, Bangalore, India. His oration is titled Integrating Yoga in Psychiatric Practices. On behalf of all the members of our department, I again welcome you all to this occasion. Thank you.
Thank you very much, Dr. Mattu. I now request Professor Mattu to kindly present a bouquet of flowers to our respected director, Professor Jagat Ram. And we will clap here on the computer as we can do. Thank you. Thank you, sir. Thank you.
This bouquet should be for Professor B. N. Gangadhar, not for me.
Sir, we do have things for Professor B. N. Gangadhar as well, but that is kept as a pleasant surprise, which will come up at the end of, after he has given his oration. May I now request Dr. B. N. Subodh, Additional Professor, Department of Psychiatry, PGI Chandigarh, to kindly present Professor G.D. Puri, Dean, Academics, PGI Chandigarh, with a flower bouquet. Sir.
Thank you. Thank you.
Thank you. Okay. Now I request our respected Professor Jagat Ram, Director, PGI MER Chandigarh, to say a few words as introductory notes to Professor N.N.Wig and the very famous oration in his honor. Professor Jagat Ram, please.
Professor B.N. Gangadhar, chief guest for the day and orator for Professor N.N.Wig oration. Professor G.D. Puri, Dean, Academic PGI. Professor Mattu, Head Department of Psychiatry PGI. Professor D. Basu, Department of Psychiatry. Former directors, Professor Emeritus, other faculty colleagues, and all the other dignitaries, dear colleagues and students. On behalf of the Institute, it is my pleasure to welcome all of you, particularly Professor B.N. Gangadhar, who is the orator of the day, to this important and prestigious oration, that is Professor N.N.Wig oration of the Institute. Department of Psychiatry at PGI has been recognized 16th of September, the day of Professor Wig joined the Institute as a lecturer in 1963 as its foundation day. Since 2016, the day is celebrated every year. Since 2018, an annual Professor N.N.Wig oration has been started at the Institute as an Institute oration. This is the third year of the oration in the honor of Professor N.N.Wig. Professor N.N.Wig does not need any introduction to those who knew him, because everybody knew him all over the world, but for the sake of others, especially for younger generation, I will first say a few words about this great man. Late Professor Narendranath Wig was born on 1st October 1930 in the West Punjab district of Gujranwala in undivided India, now in Pakistan. He completed his MBBS from King George Medical College, Lucknow in 1956 and MD Medicine from Lucknow University in 1958. Then for 2 years from 1960 to 62, he received psychiatric training in the famous Maudsley Hospital Institute of Psychiatry, London, and Western Psychiatric Institute, Pittsburgh, USA, as a Rockefeller Foundation Fellowship. He completed the diploma in psychological medicine from both England and Scotland. Professor Wig joined PGI Chandigarh on 16th of September 1963. At that time, there was no separate department of psychiatry. It was division of the internal medicine. He founded the Department of Psychiatry, and in 1968, at the age of 38 years, he became the youngest professor at PGI MER Chandigarh. He headed the department till 1980, when he joined as head of the Department of Psychiatry at the All India Institute of Medical Sciences, New Delhi. From 1984 till 1990, he was regional advisor for mental health at the Eastern Mediterranean Regional Office of the World Health Organization, Alexandria, Egypt. In this capacity, he contributed for the development of mental program of 22 countries in the region. Professor Wig's contribution to Indian and international psychiatry has been remarkable. He was an excellent clinician, a keen researcher, and a great teacher, a visionary leader. He made many seminal contributions to psychiatry in general and Indian psychiatry in particular. He laid the groundwork for the practice of general hospital psychiatry in India. Earlier, it was based mostly on the mental hospital. The community mental health program started by him in Raipurani, district Ambala, Haryana, eventually generated a model for the national mental health program in India and inspired similar program in the other developing countries. Among numerous honor to his name, two stand out in particular. One was the honorary fellowship of Royal College of Psychiatrists for the first for any person working in Asian continent. The other was naming of a unit after his name at the Fountain House Psychiatry Center at Lahore, Pakistan. Unfortunately, Professor Wig passed away on 12th of July 2018, just 2 months before delivery of the first oration in his name. However, his brilliant legacy lives on, and the two previous orations were delivered by two of his brilliant students, Professor R. Srinivasa Murthy and Professor P. Kulhada. This year we hold the third Professor N.N.Wig oration, which shall be delivered by none other than Professor B.N. Gangadhar, an illustrious psychiatrist and director of National Institute of Mental Health and Neurosciences, Bangalore, and a very decorated psychiatrist, awarded Padma Shri in 2020. And he is my colleague as well as member of Board of Governor at the National Medical Council. Once again, I welcome you all to this important and prestigious institute oration. Thank you very much.
Thank you very much, sir, for your nice introduction to the great legendary man of which we are all so very proud. And now I request Professor G.D. Puri, our respected Dean, Academics, PGI Chandigarh, to please introduce another living legend of our times, Professor B.N. Gangadhar, Director NIMHANS. Professor Puri, please.
Thank you. Padam Shri Professor B.N. Gangadhar ji, Director NIMHANS. Professor Jagatram, our Director, PGI MER Chandigarh. Professor S.K. Mattu, Head of the Department of Psychiatry at PGI Chandigarh. Professor D. Basu, Department of Psychiatry, PGI Chandigarh. Our former directors, emeritus professors, our colleagues and students. It's my privilege to introduce to the august audience our eminent speaker of the day, Padam Shri Professor B.N. Gangadhar, Director, National Institute of Mental Health and Neurosciences, who has very graciously accepted our invitation to deliver the third Professor N.N.Wig oration today. Professor Gangadhar joined NIMHANS in 1978 as trainee after doing his graduation from Bangalore Medical College. Thereafter, he completed his post-graduation in psychiatry in 1981 from NIMHANS. He joined as faculty of the institute in the year 1982 and rose to the position of director of the same institute. He has more than 400 international and national peer-reviewed indexed publications with very high H-index of 42. In addition to his specialization primarily in the psychiatry, he has special interest in schizophrenia, electroconvulsive therapy, and has used his expertise for exploitation of yoga in improving the mental and public health. He has been honored with the Doctorate of Science from Savyasa University for research work of yoga and mental health in 2012. He is a recipient of Sir C.V. Raman Award and is also Fellow of National Academy of Medical Sciences. Presently, he is also member of the Board of Governors of Medical Council of India. The topic of his oration, integrating yoga in psychiatric practice, is a great need of the hour. I hope everyone will be benefited from this. Professor Gangadhar, please.
Thank you very much, sir, for introducing Professor B.N. Gangadhar. Also, although, as you said, that he hardly needs an introduction, but now my friends and all the audience watching from all over the world, the historic moment has come, and now I invite Professor Gangadhar to please deliver the third Professor N.N.Wig oration. Sir, please.
Professor Jagatram, Professor Puri, Professor Mattu, Professor Basu, all the distinguished faculty of the esteemed Department of Psychiatry at the PGI MER Chandigarh, and all the audience who are listening to this program. At the outset, let me thank the Department of Psychiatry and PGI in general for inviting me to this prestigious oration and to speak on the subject. I must also congratulate the Department of Psychiatry, PGI, for observing and celebrating their Foundation Day, 16th September, which is a very unique day for them, marked by the entry of Professor N.N.Wig to that institute and beginning the department. So thank you for letting me into this program. Please accept my hearty congratulations on this great event and regards to all the colleagues with which I will start my talk, integrating yoga in mental health services, in psychiatry in particular. I don't have to say much about Professor N.N.Wig. Much of my learning about Professor Wig had happened in the last 40 years of my service in psychiatry. But I must thank Professor R. Srinivas Murthy, a very dear disciple of Professor N.N.Wig, who shared several articles on Professor Wig to me and introduced me in very elaborate way through these articles. But suffice to say, Professor Wig was a champion of community mental health. Because of him, as we all know, the National Mental Health Plan got launched. He had, of course, several other specialties on which he had contributed. But most important of his contributions leads to his very notable saying that mental health is too important to be left to psychiatrists alone. Clearly, he was saying that several other disciplines are required to advance mental health and to help people relieved from distresses related to mental illnesses. So, guided by this principle, he also gave a call that mental health has to be a public initiated movement and many people have to play a role. And clearly, the National Mental Health Plan, which went on to become the District Mental Health Program, had a mental health team which included not just psychiatrists, but also psychologists, social workers, and nurses. And even today, in the last 30, 35 years, we continue to retain this team of mental health, which includes not just psychiatrists, but elite professionals as well. And it has shown success in terms of the way in which the program has expanded and people are benefiting from this program. And prompted by this introduction of including other professionals in mental health services, there are many other initiatives that have happened in the country, which include, of course, training of the primary care physicians in delivering mental health, lay counselors program, training the health workers, training teachers, training the legal practitioners in mental health services. So there's a wide range of people who have been co-opted and to do their best, their part in improving the mental health status of the community. And here we have to include the Ayush group, yoga in particular. They would obviously have a role in furthering mental health. I'm sure before the introduction of allopathic medicine, psychiatry, Ayush by way of Ayurveda or yoga or Siddha must have been delivering good amount of mental health care in our community. Although I'm not going to that history, but suffice to say, yoga has become a very important component today, more so after the UN declared yoga as a formal entity and declared 21st June as the International Day of Yoga. Millions practice yoga together. And in fact, yoga has brought people together. And as the word say, it brings together, it yokes, it combines, it blends issues together. And so it says, it's interpreted as merging one's personal consciousness to that cosmic consciousness. And it is not just doing asanas or pranayamas, but it is a lifestyle change that we will have to adopt to be able to transcend to that cosmic consciousness connection. Of course, in the process, there are several benefits that yoga offers and which obviously are relevant to mental health. Otherwise, I wouldn't have chosen this topic today. And what is the relevance to mental health? Wherever yoga is referred to in our traditional texts, the role of mental health or mind automatically comes. Even in those Ramayana, they say, Manah prashamanopayaha iti yogaha. What gives you tranquility and peace of mind is yoga. And even in Bhagavad Gita, the Lord says, Samatvam yoga uchyate. Equanimity is yoga. Interestingly, in the logo of Nimhans, this statement, Samatvam yoga uchyate, comes in the logo. And more recently, Patanjali, who can be seen as the founder of yoga, of the modern day yoga, also said in the very first aphorism of the Patanjali Yoga Sutras, it says, Yoga Chitta Vritti Nirodha. So clearly, all traditional texts allude to mind as the central issue in respect of the results of yoga which we have to obtain in the process of transcending ourselves to that siddhi or that of the samadhi, which is blending my personal consciousness to that cosmic consciousness. So in the process, yoga gives several mental health benefits, which is something that I need to obtain. So clearly, the lifestyle of yoga includes what, as Lord Krishna says, yuktahara viharasya, yukta cheshtasya karmasu, yukta swapnava bodhasya, yogo bhavati dukkhaha. So yoga, if is to be seen as what is yoga, it is moderation in most of my lifestyle practices, in addition to, of course, doing yoga asana as a part of my exercise or mentoring my mind. So clearly, yoga is a lifestyle, and we have had these benefits of yoga. And what did we see when yoga was practiced? Yoga is practiced regularly. One of the yoga gurus, Dr. Bhavanani, who is in Pondicherry, whom I happened to listen to this lecture, mentioned several benefits of yoga. And of course, this is repeated by many other yoga gurus. And if you look through all the texts of yoga, in modern reviews of yoga, these are the common things that are mentioned, that a well-being, sense of relaxation, it improves connectedness within people. In fact, I can talk at length about this feelings of connectedness which yoga introduces and how it can be harvested for benefits of patients in many psychiatric disorders. although that may not be the part of the lecture in this lecture. It improves ability to concentrate, my memory, improves my self-confidence, attentiveness, ability to contain myself from becoming irritable, looking more positively towards life. These are all general benefits yoga has been claimed to produce. And many people who have been practicing yoga, these are the common ones that they narrate. It reduces the levels of anxiety, depression, and reduces stress. In fact, there is no stress reduction program, stress management program, without a component of yoga built into the entire module of their stress management. So yoga has a substantial effect on wide spectrum of psychiatric and mental health conditions, and also the well-being as well. There are, of course, several research data which have been emerging day by day. Psychological tests get better. The evoked responses, event-related potentials, they show a change for better in terms of reducing the latency, improving the amplitude, including the brain protection, increasing the gray matter size in the brain seems to have been recorded with practice of yoga. Cortisol, which is a stress hormone, becomes less. Oxidative stress in several organs gets better with yoga practice. And of course, all lead to overall improved quality of life. So there are research findings which also support that yoga is beneficial. And in the recent past, in the last 10 years, there is an exponential growth of yoga research publications which have made yoga even more popular, both in the scientific circles and in the circles of practitioners, both clinical medicine and psychiatry. In both the sections of health practices, yoga has become popularly adopted for various benefits it introduces. And we will probably focus on mental health effects of yoga and how we could integrate that. But before going into this, we need to look at all the research that was published. It is increasing, but then there are some challenges in the yoga research. There are some I will enumerate. I'm sure people who have been working on yoga, and I know one, my very dear friend, Dr. Akshay Anand, has been doing a lot of research in yoga in Chandigarh himself. We keep interacting, and we have shared some of these observations of what are the challenges. When they say yoga, there are so many schools, so many methods. The modules of yoga vary across people who have researched. There are different yoga disciplines and yoga practices, yoga approaches. When multiple practices are put into a single package, it will be difficult to say which one of the practice carries the best potential or best therapeutic effect. This is another concern that people have been expressing. Meditation research, which is in abundance, actually is another area where concerns have been expressed. People say, how are you going to ascertain that this individual actually meditated? How do you know that even if he did meditate, did you know that this is the practice that he did, not some other practice while he was meditating? And you wouldn't be able to physiologically ascertain that this individual is in fact actually meditating when you have advised him. There are very limited numbers of longitudinal studies, which makes yoga effects to be capitalized for clinical purposes even more difficult. Objective parameters of yoga effects, again, has been very little investigated, and to translate yoga into clinical application, people demand that these objective parameters to be demonstrated. And of course, more importantly, multi-center yoga research trials have not been as many. So these are all the concerns people have expressed, and I have also noted some more limitations in yoga research. Most studies are cross-sectional. Most studies talk about pre-post observation analysis. Very few studies have done a randomized design. Even when randomized design is done, control yoga practices include weight list, exercise, and these vary across different investigators and different researchers. A large number of studies have been done on healthy volunteers, and there is very limited research that has happened in clinical samples. These are all the limitations of yoga research which we need to I will probably illustrate with my own research. We did a study on yoga in outpatient depression. This is a group where people were offered yoga as a treatment in our outpatient clinic. Some chose yoga, but they insisted that they get medicines as well. And a good bulk of them wanted only medicines. So we had 3 groups of people who were self-selected. This is another common problem that we see in yoga research. So people choose medicines or yoga with medicines. Random allocation has not been very common. And when you compare a study like this, people who received medicine all did not come for follow-up. I am assuming that they all got better. Those who got better did not come for follow-up, perhaps be taking medicines at home. And those in the yoga group alone, because they have to be taught yoga, they came more religiously and more people were followed up. So a comparison between yoga and non-yoga groups becomes extremely challenging. And in fact, we have cautioned in this paper, which we have published, that this graph should not be seen as a comparison between yoga and non-yoga. Suffice to say that yoga substantially brings down depression scores in outpatient group, even when yoga is given alone. So yoga affects, but then there are a lot of limitations in the research that people are doing. I'm illustrating this with my own research as an example. One of the methods of looking at yoga effects is meta-analysis. Meta-analysis of yoga interventions in psychiatric practices demonstrates a very, very robust effect size, 3.25 in favor of yoga. So which means that yoga effects in psychiatric disorders are substantial, and we need to take cognizance of it and apply that. But if you carefully look at the yoga research that has been published, I'm taking an example, one of the recent reviews that have happened. Somebody looked at 124 research articles on yoga and neuropsychiatric disorders and found only 16 of them met research criteria, research standards rigorous enough to be considered for that review. So which means almost 9 out of 10 or 8 out of 10 publications on yoga in neuropsychiatric disorders may lack the rigor that is required to interpret them effectively and take it as an evidence for integrating or adopting yoga in our clinical practice. In mental disorders in particular, and all I have stated is yoga in general, yoga in medical conditions, but when you take mental health disorders in particular, yoga application becomes even more challenging. For example, blinding is necessarily required for any drug trial or any intervention trial in psychiatric practice. Blinding a person from yoga or non-yoga is, you can imagine what the challenge that we are facing. Yoga comes from very influential schools, Iyengar Yoga, the Sahaji Yoga, Sri Sri Yoga, Vivekananda Yoga, Kriya Yoga, Bihar School of Yoga, you can go on. And each of these schools are attached with a very, very influential person who has had both suggestion effects and the faith effects. So many researchers take this point into consideration when interpreting the yoga results, from which school it came and how much influence that school guru or the school leader could have had apart from the yoga practice itself. So there have been proposals that there has to be a generic yoga modules that people have to use, which is cross schools, which transcends beyond the schools. A yoga module is prescribed and the yoga descriptions are very clearly mentioned there, and that have to be used, calling them as the generic modules of yoga. And conducting studies in yoga practice as therapy gets another complication depending on where the patient presents. In an allopathic center like PGI or NIMHANS, or in a yoga school, which could be a yoga hospital or a naturopathy and yoga center, where the nature of people who are coming, for example, those who are coming to either PGI or NIMHANS will come with a mind that they have to be seeking an allopathic treatment. And when we offer them that you have to take yoga, like I said, amongst almost 180 patients whom we screened, only about 30 patients said that they would accept yoga. If not as a steady clinical trial, even when offered yoga, 7 out of 8 said that we would prefer only medicines. So this is another challenge that we need to face when we have to demonstrate. But if you take the group of people where they are presenting in yoga centers, the other criticism would be they were not examined, rated by standard clinical procedures that would be practiced in allopathic standards. So here we are posed with another challenge of the location of these studies. There is also another issue when it comes to psychiatric practice and yoga. The measures in psychiatric practice are often subjective, although the rating scales are very robust, but nonetheless, there is an influence of these placebo effects on these things. And this is another concern that we all have to be worried about. And almost all studies, barring a few, have used yoga with concurrent medicines. So what is the interaction? What intervention made more effect than yoga, vice versa? It is difficult to infer. Concurrent medicines are almost very common in many yoga research papers. And of course, lastly, which is something that comment that I receive from many yogis, those who are practicing yoga, say in mental health conditions, people will not have a sound mind to be able to do all that is required for a sound yoga practice. In fact, the sound yoga practice demands great degree of mindfulness in the procedure. And so if the illness is quite gross and severe, that mental state could be a major barrier to put persons into yoga as a therapeutic approach. So here we are, these challenges have been mentioned. I must refer you all to a very nice article written by Professor R. Srinivas Murthy. To me, he is N.N.Wig, because I have not seen Dr. Wig myself personally, but most of what I have learned of Professor N.N.Wig is from Dr. Srinivas Murthy, who had been my colleague and teacher at NIMANS for a couple of years when we were interacting. And I, of course, have benefited from several articles that he shared with me. And one of these articles, he talked about the need for investigating yoga with an evidence-based support for including in clinical practice. So here we are to promote yoga, to include yoga and integrate yoga in mental health practice. We need to generate robust evidence. And this evidence-based yoga approaches in psychiatry is the need of the hour. Like I mentioned, there are several challenges in the in generating the evidence base. Very typically, we all know it has to be a double-blind, randomized clinical trial. Double-blind is very difficult. Randomization is even more difficult. If they come to the allopathic center, they will say, no, we would prefer just medicines, and many people will opt out. Getting them to be allocated becomes extremely challenging. In one of the studies which we did in schizophrenia, we had to recruit, we had to interview and speak to as many as about 1,200 patients to be able to recruit 100 patients into a study where we were giving yoga as an add-on treatment. Please remember, it is not yoga alone or drug alone. Yoga as an addition to ongoing drugs or no yoga. To do this also, we had a dropout of almost 9 out of 10. So these are the challenges that we need to face in generating the clinical trials of substantial numbers to be able to produce the clinical evidence that we are talking about in yoga. Alternatively, we need to look at the biological evidence. So we are today going to see the biomarkers in yoga. I'm illustrating this with an example of how we can generate evidence in yoga applications, yoga in therapy, using one condition, depression. Although we have published articles on yoga and several other conditions, I'm not going into those details, but here research findings from depression studies demonstrating the biological evidence as biological markers of therapy in depression with yoga. Some of the examples are as follows. Of course, we know that there was a meta-analysis that was done on yoga in depression, which showed that yoga was better than usual treatment. yoga was better than exercise, yoga was better than just relaxation. So this have been noted, but people still demand more robust evidence. And one of the evidences that I perhaps would like to introduce in this oration is the biological parameters or biomarkers, which can be used as the biological evidence for clinical efficacy of yoga in depression. Depression as an example, we have also done it in other conditions, which I'm not alluding to here. Take, for example, I'll go one by one, the pathobiological markers, which yoga in quotes corrects. In depression, we know that the frontal gray matter is hypoactive and the deeper structures, amygdala or anterior cingulum, are hyperactive. This has been demonstrated, replicated, and this has led to the deep brain stimulation as well to make sure that these areas are made less active. One of the interventions in yoga is chanting Om. When Om is chanted, the deeper structures of the brain, whether it is anterior cingulum or amygdala or the hippocampus, become deactivated. This deactivation of the deeper structures, which are the part of the limbic structure, would indicate that these are the structures which in depression were active, although the study was not done in depression, but in healthy subjects they deactivate, and I see no reason why it would not happen in depression, although it remains to be examined. So one pathobiological marker of depression is correctable by one of the practices of yoga, which was a study that we did here using an fMRI paradigm. Number two, in yoga, there is an elevation of the GABA activity. And how is it relevant to depression? In depression, GABA levels are lower, whether men or women, compared to healthy subjects. This has been demonstrated by a couple of authors. And in fact, ECT effects are also supposed to enhance the GABAergic tone. That is one of the mechanisms of action of ECT. I leave that apart. So yoga, would it enhance the GABAergic transmission or GABA levels themselves? One of the recent studies by a New York group demonstrated that GABA signal in the magnetic resonance spectroscopy got increased when yoga was given to patients of depression. And they demonstrated these people also got better from their depression symptoms. So direct evidence of GABA levels increasing following yoga has been demonstrated. We did the same experiment, but in a different design using what we call as the transcranial magnetic stimulation. In this, we are able to demonstrate that the electrocerebral silence, although cortical silent period, in the EMG, as you can see there, the left end of the graph is the EMG, which gets heightened when there is a transcranial stimulus applied to actually stimulate those thumb muscles. This the EMG goes a zoom up. After some period, EMG resumes the normal activity. In this, in between, there is a electrical silence of the EMG, also called as the cortical silent period. It is not silence in the cortex, but it is a silent period induced by a change in the cortex, which is mediated by the GABA. We are able to demonstrate this silent period, which is about 50 milliseconds before yoga, got longer when yoga was given. And this person practiced yoga for 4 weeks. At the end of 4 weeks, in this healthy subject, this change happened. How is it relevant to depression? You see a pink graph on the left side and the brown one at the left and the right extreme. This is the length of the electrical cortical silent period in healthy subjects versus depression. In depression, it was shorter when compared to healthy subjects. Depression subjects randomized to receive either walking or yoga. In the walking group, of course, depression symptoms got better, but the change in this biological paradigm did not happen But in the depression subjects who received yoga, the light blue versus the dark blue graphs shows that the cortical silent period went on to get longer, inching towards the healthy subjects' values. So here again, the GABAergic mechanisms in yoga have been demonstrated. It was in a year ago, and more recently, we also published in the Canadian Journal of Psychiatry, replicating this observation in a totally different sample, but in the same paradigm. So this is the second. Now we go to the third evidence for a biological effect of yoga conducive to depression. In depressives, we know that levels of cortisol are constantly elevated. And in fact, this is a well-researched data for more than a couple of decades now. Elevated levels of cortisol are markers of depression. And so what does yoga do? Yoga, when given, more people who received yoga lost out the levels of depression. In fact, 2/3 of the people who received yoga with medicine or yoga alone, they lost the levels of cortisol to a lower level. I'm again cautioning this was not a randomized design, so I'm not willing to compare medications versus yoga. But suffice to say, 2/3 of patients who received yoga lost cortisol, indicating that another biological marker got corrected with yoga. The fourth one is the effects of yoga on the brain-derived neurotropic factor. In depression, the levels of brain-derived neurotropic factor are lower when compared to healthy subjects. The effect sizes are quite high. You treat the individual and get him better with depression, the differences between depression and healthy subjects become almost zero, and the effect sizes are near zero. Same is the case before and after treatment, the levels come down in depression. The levels of BDNF actually get better. Although the depression gets better, the levels of BDNF get better in depressive individuals. So together, BDNF has also been alluded to be a marker of depression. And what does yoga do? Yoga in this group was given to people who had depression. Depression, the blue graphs on the left side, the blue two ones, depression versus control. The depression people had lower values. After treatment, it started inching towards the healthy subjects. The same phenomenon happened in yoga-treated individuals as well. So another biological marker of yoga effect is elevating the levels of BDNF in individuals. Of course, this is incidental finding. The people who lost levels of cortisol obtained better elevations in the brain-derived neurotropic factor, and there could well be a relationship between stress and the brain repair mechanism through the brain-derived neurotropic factor. And this is why we kept saying that Chita dahati nirjeevam, Chinta dahati jeevanam. In people who are chronically depressed, by virtue of all these pathophysiological effects of increased cortisol, lowered BDNF, there could well be the effects of losing cortical gray matter, as has been demonstrated by several researchers. And what does yoga do? And here we had, although we did not experiment this in depressed individuals, 6 months of practice of yoga in elderly, otherwise healthy individuals. At the end of 6 months, pre and post comparison of their MRI showed a small, albeit significant, increases in the gray matter of their hippocampi. Hippocampus we chose because that is the earliest area which will start decaying in elderly individuals with brain decay. And here we have data that practice of yoga for 6 months protected them and also facilitated increase in the gray matter, the details of which we need to look into. Sadly, we did not have a group of controls in this data. So we are cautioning the readers and the audience that this interpretation has to be made with that pinch of salt. So depression, we could not demonstrate this effect, but there are many other researchers who have demonstrated that the cortical gray matter is preserved in individuals who have been practicing yoga for long numbers of years. But in those who did not practice yoga, healthy otherwise, like all of us, with age-dependent drop in gray matter happens. So yoga protects brain from the effects of losing the gray matter. And possibly because of the depression, I'm losing gray matter. and yoga could protect this. So here we have a cycle of events that will happen in depression, which leads to loss of gray matter. That cycle probably is corrected by depression. Decreased frontal activity elsewhere, other authors have demonstrated that yoga increases the gray matter frontal activity. The increased amygdala activity that happens in depression, one of the practices, Om chanting, reduces it. Although we did not do it in depressive subjects, that apart. Decreased levels of GABA reversed by yoga, increasing the levels of GABA. Increases in the levels of cortisol, a stress hormone, which is injurious to the brain, also are decreased following yoga. Decreased levels of the brain-derived neurotrophic factor, which are present in depression, again are corrected in quotes by yoga by increasing the levels of BDNF. Cortical thinning that happens in depression, some prevention of cortical loss, gray matter loss, happens in yoga practitioners in healthy subjects or elderly subjects who otherwise have no depression. So, in other words, evidence of yoga in neuroscience of depression should encourage us to practice yoga, at least in this condition, depression. We do agree that we need to replicate these findings in other illnesses as well. We have a lead in schizophrenia, for example, connectedness within the brain of the default mode network increases following yoga practices, in addition to them getting better with respect to negative symptoms. The default mode network coherence improves from pink, it goes on to become yellow. That is the color coding of the increase in the coherence. So there is biological evidence of yoga effects in psychiatric disorders. Many other psychiatric disorders too have had these biological evidences, although I'm not alluding to them in this stage. So in summary, hospital-based research supports a case for yoga, at least in depression I have demonstrated. We need to look at it more extensively in other conditions, may it be schizophrenia, may it be anxiety disorders, substance use disorders, and so on and so forth. Hospital-based researchers should also help us to extrapolate the same thing into community applications of yoga in clinical practice and also at the field level. So we would probably be reaching a day when yoga therapists should also become a part of the mental health team. A wider net of operators in the healthcare, mental health care in particular, through this method of including yoga would probably be a great tribute to Professor N.N.Wig. I stop here. All what I presented, a few acknowledgements to several of my colleagues who practiced in most of the research that I have presented and shared with you here. I also invite you to be a part of our yoga conference, which is going to be coming up on 16th and 17th of this year, October, which is called the Yantra. www.yantra2020.com will lead you to that program. Thanks once again for letting me come over and share some of these thoughts on yoga. How do we integrate? How do we build evidence? How do we include them as part of the mental health care activity holistically? Thanks a lot. Thank you once again.
Thank you. Thank you very much, sir. Thank you very much for this wonderful, inspiring, fascinating journey which you took us through. I'm kind of short of words to really to say that how you and your team have done a wonderful work and presenting it to the world. So thank you very much once again. And I'm sure because we don't have the lecture theater one kind of ambience where you could have heard the claps, but this is over the YouTube. I can assure you there are more than 200 people from all over the world who have watched this. And so thanks again. And now I request, now again, normally it's our tradition that the orator at the N.N.Wig oration receives a gift, a shawl and a plaque. But our teletechnology has not yet advanced to that level that we can give it straight away to you. We will send it by post. But at the moment we thought of doing something interesting. may I request Dr. S.K. Mattu to please present the shawl and the plaque to our director PGI, who will receive it on your behalf, sir. Who will receive it? Okay, sir, Dr. Mattu, please, yeah, can you please? Thank you.
So Jagatram ji, all the best and congratulations. In a lighter vein, sir. In a lighter vein.
And it is an honor for us but this shawl is not for me, this is for you. It is, they are putting responsibility on me. I have to send it to you. So
Thank you, sir.
Thank you, sir.
Thank you very much, sir.
There is a plaque also, which is your name inscribed on that, and that again, that will also be sent. Yeah, if you can please show it on the, yes, sir. Yes.
Yes, wonderful, sir. Thank you so much.
Okay.
Thank you very much.
Thank you. Thank you. So after this, it is my pleasant duty to finish off the program with a profuse, heartfelt vote of thanks to a lot of people, of course, without whom nothing would have been possible. Professor B.N. Gangadhar, as I said, for a fascinating, inspiring, and I would say very humbling. I mean, there were times when I was listening to you, sir, and I mean, there's a lot that lot of other people, the generations of the younger researchers should be inspired, and so much needs to be done. And so you have kind of laid the way for that. So I don't have enough words to thank you, sir. Also, I'm very grateful to our Director PGI, Professor Jagatram, and our Dean Academics, Sir Professor G.D. Puri. We have great respect for both of them to take time out of their busy schedule for this institute oration, be there all the time. Although I remember I told Dr. Puri, ki, sir, you can do your own work, nobody can see you. But I can see him on the Zoom, and I could see that he had watched your talk, sir, throughout the period. So you can see, and he's an ace anesthetist and intensivist. So it's all we are all in this together. So thanks to both of you, sir. I am very thankful to our all our present and past faculty, all our past directors. I could, on the YouTube live chat, I could see the name of Professor Yogesh Chawla. I'm sure there would be other people. I could only catch once in a while the names. Former dignitaries, deans, and directors, and the former head of departments. I could see the name of Professor P. Sure, Madam Dr. Savita Malhotra and Dr. Ajit Avasti, they would all be there. I could see Professor R. Srinivas Murthy's name, and so many other different people. There's a large number of audience, and I could personally connect with people from Liverpool, my friend Dr. Sudeep Sikdar, and other people from the UK, Dr. Anant Pandurangi, and he writes that it's very early in the morning, in the live chat. It's very early. Of course, it's extremely early in the morning there. And he says that what a nice way to start the day with VNG's lecture. So I'm just giving you snippets of how people have enjoyed and have done that. A large number from all over India and from all over the world. The telemedicine department, both from PGI and IMHANS, deserves a very big. Again, we can't clap from here, but they deserve a very big appreciation because they have made it possible. They brought the world together. So a big thank you to the telemedicine facility of the IMHANS and PGI. We must also thank the director's office, again, both at PGI and IMHANS. How can I forget Mr. Siddharth Wig, son of Professor N.N.Wig. He can't be seen here, but I know that he's on the Zoom there, and his wife Anant. They are our good friends of the department of ours, and they are they remind us of Professor N.N.Wig. So thank you, Siddharth. Thank you, Anant. Lastly, I must thank our departmental colleagues, without whom this would not have been possible. Especially, I would like to take the name of Dr. Ruchita Shah, Dr. Subodh B.N. and Professor Ritu Nera, amongst others. We can't thank ourselves, but it's just that we are in this together. So at the end of the day, the only thing we'll be missing, sir, is that normally we invite you to a cup of tea. Now that in the virtual platform is still not possible so far. Maybe the next N.N.Wig oration, if it still happens, we might evolve some ways of providing that. But right now, short of that, thanks to everybody. Sir, would you like to say any last words, Professor Gangadhar and Professor Jagatram or Professor Mattu? Anyone, please, for a last word, and then we can close this forum. Dr. Jagatram, would you like to say a few words, sir?
Yeah, surely. I think I know Professor Gangadhar for the last several years, and my association in this as a board of governor in Medical Council of India, and now known as National Medical Council. So it is a very long association, and it was an outstanding oration and very inspiring, and it is absolutely a new field. So it is really a inspiration for every one of us, and particularly for younger generation. Thank you, Professor Gangadhar.
Thank you very much, sir. With your kind permission, then I seek your permission for closing this session. Thanks to all again. Thank you.
Thank you very much. Thank you very much.